We know that when fungus grows, it extends its hyphae or mycelia in every direction to find food and water. So when these mycelium becomes compact, they are known as sclerotium. So the sclerotium of a particular parasitic fungus known as Claviceps purpura is known as ergot. It grows on cereal, rye, wheat, barley, etc., and forms a characteristic purple colored mass on the grain, which, when powdered, gives us ergot. The three important active principles of this parasitic fungus are ergotoxin, ergotamine, and ergometrine. Now, we remember from pharma that many of the drugs are ergot derivatives. Because they contract the smooth muscles of arteries, intestine, and uterus, they can be used as uterine stimulants and also in migraine treatment to stop the pulsatile vasoconstriction and vasodilation of the cerebral arteries. The signs and symptoms of acute and chronic ergot poisoning are different. Acute poisoning is actually rare, while the chronic poisoning was common in the past due to ingestion of ergot contaminated flour. The acute poisoning are mainly due to the smooth muscle contraction. The main symptoms are that of the irritation, such as the irritation of the throat, dryness, intense thirst, nausea, vomiting, diarrhea, pain in the abdomen. Also, there is tingling in the hands and feet due to the vasoconstriction, and there can be muscle cramps, dizziness, and cold feeling, and all of these result from smooth muscle contraction. There can be abortion and hemorrhages in the uterus because of contraction, and bleeding from the nose and other mucous membranes is also common. The chronic poisoning, also known as ergotism, is more common. Was more common actually, it's not common now. The chief symptoms are due to GI catarrh, that means inflammation of the GI mucous membranes. The GI catarrh is followed by two forms of ergotism. First is the gangrenous form, and the second is the convulsive form. The gangrenous form, as you can expect, resembles Raynaud's disease, which is a peripheral arterial disease that leads to gangrene of the peripheries, such as fingers, toes, etc. It can also cause gangrene of the nose and ear, etc. The intestine can also undergo gangrene and cause ulcers. The CNS effects in the convulsive form can be painful tonic contractions of voluntary muscles. There is drowsiness, headache, giddiness can lead to madness in severe cases. There is skin itching, numbness, and formication, which is a feeling that ants are creeping on the skin, and there can be severe psychiatric disturbances. The fatal dose of ergot is about 1 gram, and the fatal period is from 24 hours to several days. The treatment is different in acute and chronic poisoning cases. In acute poisoning, we mainly focus on emptying the stomach and the bowel from the poison by different processes such as stomach wash, purgatives, etc. And in chronic poisoning, what we first do is discontinue the exposure and then do symptomatic treatment. Vasodilators can be helpful because it causes vasoconstriction. Post-mortem appearances are not characteristic. There can be congestion of internal organs, and the mycelium or sclerota can be detected in the stomach, and there is also gangrene of the toes and fingers. Medicolegally, acutely, if it is used in large doses, it can cause abortion. It's been used for to procure abortion, and chronically, it's, as I've already mentioned, it is due to the use of contaminated bread.